Hi, my name is Jamie Marie Lagman. I'm in BSN 266. This is going to be my tracheostomy care remediation video. I have my Nightingale scrubs on, and then I also have my Nightingale badge. Before I begin, I'm going to go over all of the supplies that's needed for trach care. So you need hand sanitizer, gloves, normal saline. I don't have normal saline, so this will act as that. The tracheostomy clean and care tray. My tray is already open because I've been practicing, but obviously you would want a completely brand new unopened tracheostomy clean and care tray, and a trash can and some tape. I've already pre-cut some tape ahead of time. So those are all the supplies that's needed for trach care. And now before I go into my patient's room, I'm going to first verify that there is a doctor's order for trach care for this specific patient. There is orders for trach care, and now I'm going to gather my supplies, go into my patient's room, knock knock, perform hand hygiene. And then I'm going to provide privacy by closing the door behind me and closing the curtain. Now I'm going to introduce myself. Hi, my name is Jamie. I'm going to be your student nurse for today. It looks like the doctor has ordered for you to receive some trach care. Can I get your name and your date of birth? Okay, perfect. I was able to verify the name and the date of birth by using their wristband. Do you have any allergies you're aware of? You don't have any allergies? Okay, perfect. And now I'm going to provide information and education about what I'm going to be doing. So the doctor has ordered some trach care. What that entails is I'm going to change the gauze around your trach, and then I'm also going to be changing the ties. This procedure should take about 10 to 15 minutes. If at any point that you would like to stop or you need a break, you can just raise your hand and that'll be an indicator for me to stop what I'm doing, and we can take a break from there. Did you have any questions, concerns? No? Okay, perfect. Once I've told the patient what I'm going to do, I'm going to raise his bed to an appropriate working height, and then I'm going to fix the head of the bed so that it is at a 30-degree angle unless it's contraindicated. In this case, it's not. Now I'm going to assess the cardiopulmonary. I'm going to assess your vitals. Vitals look good. Everything looks good. And at this point, I'm going to place a pulse ox. The pulse ox will have to remain on your finger throughout the entire course of this procedure, just so we can assess how you're doing. All right, do you have any questions about that? No? Okay, and then at this point, I would also pre-oxygenate my patient for 30 seconds and then have them take big deep breaths in and out. And at this time, I would also suction if needed. So suctioning is not needed at this point. Then I'm gonna perform hand hygiene again, like so. And I'm going to put on my clean gloves so that I can remove the soiled dressing. I'm gonna remove the soil dressing now. Perfect. And once I have that, I have it balled into my glove. Then I'm gonna discard it into my trash can and perform hand hygiene again. Now At this point, I'm going to open my trach and clean care tray, and I'm going to open it away from me, like so. And I'm going to take the sterile gloves, put them to the side, and then I'm going to take the drape, and I'm going to make sure I only hold the shiny side, and I'm going to lay it onto my patient. Like so. And then I'm going to take this time, and I'm also going to dump all of my supplies into the top of the kit, like so. And once I have that, then I'm gonna pour my normal saline into the trays and add the cleaning solution as well. Once that has all been added, now I'm gonna put on my sterile gloves, which I'm just gonna move it. Okay. Perfect. Now I'm gonna open my sterile gloves, making sure that I'm opening it away from me, and making sure that I flatten out my gloves. And then I'm gonna take the 1-inch border, making sure I only hold on to that, and using that to open it, making sure I'm only touching that, flattening it. And then to put on my sterile gloves, I'm just gonna pinch it at the cuffed part, and I'm gonna slide my hand inside like so. And then once I have my one glove on, then I'm gonna reach for my other hand, and I'm gonna go 3 or 4 fingers underneath that cuff. And I'm just gonna slide my other hand through like so. And I'm gonna make sure that I keep my hands above my waist at all times now. And now I'm going to organize all of my supplies. And I'm gonna take my brush and my Q-tips, and I'm just gonna place that in the cleaning solution as well. And then I have all of those ready. And then I have my tie ready. Once I've organized all my supplies, now I'm going to remove the tracheostomy inner cannula, and I'm going to remove it by going with the curvature of the cannula, like so. And I'm just going to drop it in the cleaning solution. Once I have that in there, then I'm going to clean the inner cannula. So I'm going to take the brush it, making sure it's nice and clean. Perfect. And once I have it all cleaned and it's all dry, then I'm ready to put it back in. I'm gonna put it in at the angle of the curvature of the cannula. And at this point, I'm also going to be cleaning the tracheostomy site. So I'm just gonna take it. Sorry, I wouldn't be doing that in real life. Obviously, I just need to get a better angle, but I'm just cleaning the front base plate. And then below. Make sure it's nice and clean. And then we're gonna take the gauze and we're just gonna pat dry everything. So everything is nice and dry. Perfect. Everything is dry. Now I'm gonna put on the split gauze. So I'm just gonna take the split gauze and put it around the trach site. I'm not sure how well you can see that. I'm gonna move the mannequin head just a little bit closer for you to see. Obviously this wouldn't be done in real life, but I just need you guys to see what I'm doing. Okay. Once the split gauze has been added, at this point we're gonna change the ties of the trach. This is normally a 2-person job, so I would need to have an assistant to hold the cannula and the trach in place, but because this is a skills video, I'm just gonna be holding on to the inner cannula and the trach. But I'm going to undo the ties like so. And then I'm just gonna place brand new ties, making sure that I hold the trach in place. So now I'm just adding the ties. And then as I'm adding it, I want to make sure that I place it nice and flat on the neck, because we also want to protect the skin integrity of the patient's neck. So I want to make sure that it's all nice and flat and not all wrinkled. And then I'm gonna loop it around and I'm just gonna tie it back here. Now that that is all tied, I'm going to go around the trach ties and I'm just gonna make sure that I can fit 3 fingers underneath the trach ties, because you want to make sure that it's also not too tight either. So I can fit 3 fingers underneath the trach ties, so it's nice and not too tight. And then for the knot that was made in the back, what I'm going to do is I'm going to take a 4x4 gauze and I'm just going to place it underneath where I knotted the trach ties. Again, just because of the skin integrity issue, we want to make sure that they're nice and comfortable. So I'm just going to take the 4x4 gauze and place it around that knot that I made. And I'm just going to close it off like so. So the trach care has fully been finished. I'm just gonna take all of my trash, put it in the trash can, remove my gloves, perform hand hygiene, and at this point I'm going to remove the pulse ox, ask the question if they're okay, making sure that they're okay. Are you okay? Is everything all right? Do you have any problems at all? No? Okay, perfect. Once I've established that he tolerated the procedure well, I'm just gonna lower his bed to the lowest position, and I'm gonna make sure that the call light is in reach. Making sure I remove that pulse ox from him, taking all of my trash away from the patient's room, perform hand hygiene, and thank them today. Thank you so much for your time. And I'm just gonna take all my trash and leave, perform hand hygiene. At this point, now that I have officially left the patient's room, I'm going to document how the patient tolerated the procedure, if at any point he needed to take a break, if there was any discharge on the soiled gauze, I would also document that. And that's pretty much it. Thank you so much. This was my tracheostomy care video.